Giadich, or Hello in Irish, Ireland's Healthcare System versus the United States Healthcare System by Sarah Kloster. One major issue in Ireland's healthcare system is their training. So Ireland is losing providers to medical migration, and they are emigrating to different countries to receive the superior training that they feel fit. So Merriam-Webster defines emigration as the departure from a place of abode, natural home, or country for life or residence elsewhere. Ireland has a 6.4% emigration rate for Irish trained graduates under the age of 30. But since all of this, Ireland has started to actively recruit to staff their positions. Researchers Bruga et al. Used the Doctor Migration Project to gain information on where providers were going, which is concentrated to the United States, Canada, the United Kingdom, Australia, and New Zealand. This project revealed that the positions that are being deemed as difficult to fill are actually those that don't have a degree or career progression, and those who left in those positions that left the people in them feeling like they were becoming de-skilled. Bruga et al. Found that even migrant doctors are emigrating out of Ireland because they are dissatisfied with the working conditions and career opportunities. Bruga et al. Also mentioned the primary aim is to retain Irish trained doctors by placing them in posts or positions that may not be qualified for. This is being closely monitored by the National Health Workforce researchers. And Ireland, in comparison to the United States, is similar in many ways. The population in both Ireland and the US continues to age, which in the case of healthcare workers can be considered a good thing, since as we age, it usually requires more care, which will require more jobs and more workers. So by retaining Irish trained doctors, they hope to offer better working conditions such as flexible hours, equitable salary levels, better access to training, clearer career paths, and better data to comprehend medical migration. The U.S. is also being a powerhouse for healthcare, inevitably offers better opportunities for training and advancement compared to Ireland. The quality of care is increasing, and the quality of care in Ireland is threatened by the medical migration that occurs within the country. Ireland is working to improve their country's care by working towards policy reform that may develop into a universal single-tiered healthcare system. Unfortunately, this universal healthcare system that is highly regarded and wanted by many has been difficult to get off the ground due to politics, taxes, and the economy of the country falling. One way that Boat mentions there might be an increase in the quality of care of Ireland is increasing the competition within the healthcare system, including among insurances, which can give the citizens better quality of care at a lower cost. So what is being done? Murphy is quoted stating that quality is something to strive towards, an aspiration to be achieved. She also stated that healthcare is shifting constantly, though in regards to quality, it is shifting to be more healthcare focused and person-centered. This is evident in the care elderly patients receive, that they are made comfortable while being cared for, and they are treated with respect. The Age 80 allowance is what the government of Ireland is doing to take care of the aging population by continuing to provide for them because they are compensated and well taken care of to maintain their well-being. Compared to the US, Ireland is looking pretty good when it comes to their quality of care. The US has a high cost, but they continue to lack in their quality of care. Again, their high costs do not equal the quality of care, and the US is not doing well in terms of surpassing other countries when it comes to that quality, because they were ranked last among 11 industrialized countries on measures of quality, efficiency, access, equity, and healthy lives. What are the levels of satisfaction? So Ireland has used the National Health Strategy and shifted their focus of their healthcare system to be more consistent with the values of equity, quality, and accountability. Also stating that there are 6 main areas of focus, some of those that include increasing the strength of primary care, improved funding, and better training for healthcare workers. Slattencare is the proposed 10-year plan that establishes the universal healthcare system that focuses on primary care. This provides reform for all political sides and helps the population by reducing out-of-pocket spending. The majority of the Irish population are positive when discussing this universal healthcare system and hopes it brings a level of satisfaction in their care that they haven't felt in a while. Not only does having the universal healthcare help with satisfaction, but if someone views their care at a high quality with a professional who has the integrity to work, their perception and level of satisfaction will be improved. One way that they hope to improve is decreasing wait times and to be seen for different diagnoses. So, what is being done? The budget for Ireland's healthcare system goes back and forth between the governing powers of the Prime Minister and those who hold other offices, but usually is reallocated for other things that the country needs. The overall goal is to find a healthcare system that works for the country. Ireland has been under constant reform and needs to finally implement a system that helps their citizens and helps them feel satisfied with their care. The US, in comparison to other developed countries, does not provide much satisfaction in part to accessing most preferred care, which is the extended to which people feel that they can access their top preferences at a time of need. Ireland also focuses on long-term care. So Ireland provides care for children, mothers or women of reproductive age. By providing this care, they decided to merge 3 existing children's hospitals into one national hospital to provide better long-term care for those children who need it, since children are considered the future and need to be invested in. As mentioned previously, Ireland also has the Age 80 allowance, which gives certain stipend to those who make it to a certain age, and this helps them out of poverty because the country is helping provide them with monetary means. So, what is being done in long term care? Ireland is focusing their long term care on their elderly and older population. The government has implemented a 10-year strategy that prioritizes this by having community based support in the form of daycare centers for seniors and nursing home subvention, which is income based housing on a 3-tiered system. These community based systems that are being implemented are all tax based and government funded. In comparison to the US, the United States does not fund long-term care. These are usually services provided by unpaid caregivers who are usually family members or friends. In a 2015 AARP study, 43.5 million people took on that role of unpaid caregiver. Medicare is also utilized for those 65 years or older and some younger with disabilities in the US. This is funded through the federal government. What are the changes that are being seen in Ireland? The health service in Ireland is not what it should be, even with all the progression they have made in the last decade. They are still lacking in quality, access, and cost efficiency. They have invested in women's health by developing ways to repeal the constitutional dictation on a woman's choice of abortion, though this has not been passed yet but it is being seen as an entry point. By starting to implement Slayton Care, the country is moving towards universal health care if they can continue on the up and up with their budget. The country is also moving towards a focus on primary care to help the well-being of their citizens and promote healthy lifestyles. This includes new proposals that start with a 5-year plan and focus on standard of living and the poverty line in Ireland. Ireland is changing in many different ways. They are taking responsibility for their actions and they are actively recruiting and investing in their own people. As a developed country, they will continue to strive and utilize up and coming technology. In comparison to the US, they are not attempting to build a universal healthcare system, though there have been rumblings. There have been changes in the healthcare financing because the bottom 20% of the population was paying about 26.8% of their income in healthcare costs. But with Medicaid and the Affordable Care Act marketplace, things have evened out a bit. Slán go fóill. Goodbye for now.